In Boston, Mayor Marty Walsh declared a public health emergency over the weekend and set a mandatory 11 p.m. closing time for all restaurants and coffee shops. Today, he announced he's suspending construction in the city. Several Boston centers for youth and family sites are being closed, as are all library branches, as a fund is created to help families in need. Mayor Marty Walsh joins me now. Mr. Mayor, it's good to see you.
Thanks for having me.
So, Governor closes schools statewide for 3 weeks. You double it through nearly the end of April. You reduced the bar and restaurant capacity. He shut them down totally. Today, as I said, construction, that may be the first in the country I've heard. Libraries, community centers. It seems to me that you're doing a few more things a day and ultimately leading to a total shutdown other than groceries, pharmacies, and hospitals. Is that where we're going?
We are, but what we're doing No, we're heading that way. I mean, I think in a lot of cases, our centers, BCYF centers, we have to think through how we have to keep some of them open, which we're doing food service for our kids that we shut the schools down. And we're also doing a couple other things in there. We have our street worker program still working out in the streets. Our libraries, we went from a thought process of trying to figure out a situation to keep them open a little bit to today we made a decision to close them down. Now we're going to go back and see how we get books out to people. We're looking systematically going through the city now. We provide a service, and people expect that service to be provided even in the midst of the coronavirus. So we're looking through who can work from home and who can't.
But I want to return to what I think you said a minute ago. Ultimately, if things don't change, we're leading to grocery stores open, pharmacies open, hospitals open. That's it in Boston.
Coffee shops maybe and sub shops.
But essentially, the city's shut down other than those limited services.
For the most part, you're seeing that right now.
So why are you not just doing that in one fell swoop?
Because you don't have to right now. You're systematically doing it just to see as we look at the numbers and we're preparing for the inevitable potentially. I'm hoping I'm wrong. I'm hoping the schools are back in 3 weeks. I'm hoping that the construction sites are up in 2 weeks. I'm hoping all that's going on, and I think the actions that are being taken on a statewide level and the city level right here and right now prevent from the curve going up as far as the coronavirus.
But if not, it's all shut down.
I mean, ultimately, I think we have to look at the lessons of Italy and they shut the country down. I hope we don't get there. But I think the more aggressive we are right now with listening and not connecting to each other, I think that's important.
Governor Cuomo talked about non-essential businesses shutting down at 8 o'clock in New York State. Is that something you'd contemplate here?
Not yet. I mean, I think that, again, I think a lot of people are hearing to the streets of Boston are pretty quiet today. Not much traffic out there. I think people are really paying attention, and that potentially can make a real big difference when it comes to the spread of the virus.
Was the tipping point for you the crowds in South Boston on Saturday night outside the bars? The visuals are unbelievable.
Absolutely.
That was it.
I mean, as far as the bars and what we did, and then the governor took more extreme action after that, a couple hours later. But thinking about, like, looking at the crowds, thinking, like, I don't know, for the last week, I've been on TV several times, the governor's been on TV several times, the president's been on TV. Like, this is a serious issue. And to have that many people going in line and going into a bar and not taking this serious, I mean, we're trying to prevent what's called community spread from happening. And having people in line there, it was, not really good for them, and actually dangerous for other people too, because if they contact the coronavirus and they're going around the communities, that's what community spread happens.
Do you think 20s and 30-somethings just don't get it?
I think people are starting to pay attention. I think everyone has to take this serious. The last week or two, I've been talking to people. This is not as bad as the cold is worse. More people have died from the cold, the common flu, and that may be true. But the coronavirus is something we've never experienced before.
Also may not be true, and then some.
So I think that we have to take all the precautions.
Are you worried about, I read today that the T, cutting back essentially to Saturday service on the trains, most of the buses, I assume that's in response to the fact there's diminished demand. But the flip side is less availability means crowds are larger than they otherwise would be. Isn't the goal to have as many trains as possible so that people are dispersed as much as possible?
I think what we're trying to do is encourage people to work from home as best as possible. Companies work with folks. And again, like I said, City Hall, we've been working almost at full capacity, and I thank the workers there. Over the next couple of days, that'll be a different situation in City Hall itself.
What's this One Fund? One Fund was obviously this incredible thing created. What's it called?
Resiliency Fund.
Oh, I didn't know it had a name.
Yeah.
What's that going to? Who's going to benefit? And who's giving the money?
It's going to be, for food. Eventually, if we need to increase our access to food and have ability to raise money for food, for technology for our students to be able to buy some of the Chromebooks and other technology to teach kids from home, and also working right now on child care providers for first responders. So if in the event that more and more people are staying home from work, they don't have to go to work, nurses, doctors, police, fire, EMS still has to show up at work. So making sure there's potential childcare there. We're working with Mass General Hospital, and we're working with the City of Boston and other nonprofit providers to make sure we have some form of childcare still there. Many childcare providers have closed their doors.
Do you have a fundraising goal for this thing or no?
No, we initially thought, just to kind of speculate, maybe we could raise $10 million. We raised $10 million today, so the goal is $20 million.
The president was asked at his press conference this afternoon, where I think he was more reality-based than he's mostly been to date, but he was asked to rate his own performance thus far in the time of this pandemic, and he gave himself a 10. What would you give him?
I'm not getting into that.
How's he done?
I've made it perfectly clear. This is not a time, I don't think, to have politics play into it. This is about protecting people and moving forward. I'm not going to get into the political stuff here.
Okay, so what do you say to, we on the radio today continue to have people calling saying Baker's going too far, Walsh is going too far. What do you say to those people of goodwill who honestly believe this isn't necessary?
I hope we've gone too far. I said that the other day when I was asked a question. I hope in 3 weeks people can say, you did too much, it shouldn't have happened. I hope that's the answer. And let me defend myself in that case. I'm praying that that's the answer.
Mr. Mayor, it's good to see you.
Thank you
Thanks so much. Good luck with everything. Mayor Marty Walsh. And be sure to join us Friday on Boston Public Radio, and the mayor will join us to take your calls.